How vaccines nearly eradicated hepatitis B in Uzbekistan's children, a lesson for the world. Understanding the silent danger. We live in a world where many diseases that once threatened entire generations have now almost vanished thanks to just one small shot. But what happens when a small country, once battling alarmingly high infection rates, rises to become a global model for controlling hepatitis B in children? That's the remarkable story of Uzbekistan, a Central Asian nation that, within just 20 years, reduced chronic hepatitis B in children to a mere 0.2%, one of the lowest rates in the world. But to truly appreciate this achievement, we need to go back to the beginning. What is hepatitis B? Why is it so dangerous? And how can a vaccine hold such powerful impact? Part 1. What is hepatitis? Why is it called the silent killer? Hepatitis B, or HBV, is a serious infection caused by a virus that primarily attacks the liver, an essential organ responsible for filtering toxins from the blood, producing bile to digest fats, and storing energy for the body. What makes hepatitis B so dangerous is its silent nature. In many cases, people who are infected show no clear symptoms at all. They may feel healthy for months, or even years, completely unaware that the virus is silently damaging their liver. And here's the frightening part. The virus can stay hidden inside the body for decades, slowly attacking liver cells without being detected. By the time warning signs appear, such as yellowing of the skin, chronic fatigue, nausea, or pain in the upper right side of the abdomen, liver might already be seriously damaged. There are two main forms of hepatitis B. Acute hepatitis B is a short-term infection. It usually lasts a few weeks and then resolves on its own, especially in healthy adults with a strong immune system. Some may experience flu-like symptoms, while others may have no symptoms at all. Chronic hepatitis B is the more dangerous form. If the virus remains in the body for more than 6 months, the infection becomes chronic. Over time, it can cause liver fibrosis, scarring, cirrhosis, permanent liver damage, liver failure, and even liver cancer. Many people with chronic hepatitis B only discover their condition once complications arise, which could be years after the initial infection. According to the World Health Organization, hepatitis B is responsible for over 820,000 deaths every year due to complications like cirrhosis and liver cancer. That's almost equal to the number of deaths caused by HIV, AIDS globally. And yet, many people don't even know they're carrying the virus. That's why hepatitis B is often called the silent killer. It works quietly, invisibly, and fatally if left undetected or untreated. Part 2. The highest risk. Infants and young children. When it comes to hepatitis B, not everyone faces the same level of risk. The most vulnerable by far are newborns and young children. And that's exactly what makes hepatitis B so dangerous. The earlier in life someone gets infected, the higher the chance the infection will become chronic. Let's look at the data. Healthy adults who contract hepatitis B usually fight off the virus. Only about 5 to 10% of them go on to develop chronic hepatitis B. Children under the age of 5, however, face a far greater risk. Between 30 to 50% of infected children in this age group will develop chronic infections. But the most alarming statistic of all comes from newborns. If a baby is infected at birth, especially if the mother is already carrying the virus, there's up to a 90% chance that the child will develop chronic hepatitis B. Why are infants and children more vulnerable? The reason lies in their underdeveloped immune systems. An adult's immune system can usually recognize the virus and mount a strong response to eliminate it. But a newborn's immune defenses are still immature. They may not recognize the virus as a threat, allowing it to quietly settle into liver cells and replicate without triggering any strong reaction. This silent invasion means the baby doesn't show symptoms. There's no obvious sign that something is wrong, but the virus is slowly and steadily attacking the liver. And because there are no symptoms, The infection often goes undetected, sometimes for years or decades, until liver damage is already severe. Bottom line, early infection means a higher risk of chronic disease. This is why preventing hepatitis B transmission during childbirth and protecting children as early as possible is absolutely critical. Part 3. The ultimate solution. The hepatitis B vaccine. When it comes to preventing hepatitis B, there is no treatment more effective, more reliable, and more powerful than vaccination. In fact, the hepatitis B vaccine is considered one of the safest and most effective vaccines ever developed in modern medicine. How does it work? The vaccine introduces a harmless piece of the virus, not the actual virus itself, into the body. This helps the immune system learn to recognize and fight hepatitis B without ever being exposed to a real infection. So, if the vaccinated person ever comes into contact with the real virus later in life, their body is already trained to respond immediately and destroy the virus before it can do any harm. The vaccination schedule is simple but critical. First dose, within 24 hours of birth. This is the most important dose, especially for babies born to mothers who might be infected. It's the first and strongest line of defense against mother-to-child transmission. Second dose, at least 4 weeks after the first dose. This reinforces the immune response. Third dose, another 4 weeks later. This solidifies long-term protection, ensuring the immune system develops full memory against the virus. In some national immunization programs, a fourth booster may be added, but the 3-dose schedule remains the global standard. How effective is the vaccine? Provides 98 to 100% protection when the full course is completed. Works even in high-risk newborns, including those born to infected mothers. Prevents chronic infection, cirrhosis, and liver cancer. Protection lasts at least 20 years, and likely for life in most people. Why is early vaccination so important? Because, as we've seen, infants are most at risk of developing chronic hepatitis B. The earlier they're protected, the more likely we are to stop the virus before it ever has a chance to invade the liver. That's why the World Health Organization recommends all infants should receive their first dose of the hepatitis B vaccine as soon as possible after birth, preferably within 24 hours. This recommendation has been adopted by more than 190 countries, forming the cornerstone of global hepatitis B prevention efforts. Vaccination equals prevention, and prevention equals future health. In a world where hepatitis B still claims hundreds of thousands of lives each year, the vaccine is not just a showtiz, a life-saving shield. And, as we'll see in the next part, some countries have used this shield to achieve near-miraculous results, Uzbekistan being one of the best examples. Part 4. Uzbekistan. From fragile beginnings to a global symbol of success. Back in 2001, Uzbekistan was far from a public health success story. The country faced alarmingly high rates of hepatitis B, particularly among infants and young children. Its healthcare system was underdeveloped, with limited infrastructure, insufficient coordination, and uneven access to preventive care. Most importantly, very few children received the hepatitis B vaccine on Timor at all. This meant thousands were being born into a lifelong risk of chronic liver disease without any protection. A turning point came that same year. Uzbekistan partnered with Gavi, the Vaccine Alliance, an international organization dedicated to increasing access to vaccines in low- and middle-income countries. With an initial grant of $4.5 million, Uzbekistan launched a nationwide hepatitis B immunization program in October 2001. The strategy was clear and evidence-based. First dose administered within 24 hours of birth in maternity wards across the country. Second and third doses given over the next few months. Following WHO's recommended schedule, medical staff were trained. Vaccine distribution was strengthened. The birth dose became standard protocol. For many families in Uzbekistan, This was the first time they had reliable access to life-saving vaccines at birth. In 2009, Uzbekistan advanced further by transitioning from standalone hepatitis B shots to the pentavalent Vaccination, a single injection that protects against 5 serious diseases: hepatitis B, diphtheria, tetanus, pertussis, whooping cough, and Haemophilus influenzae type B, Hib. This move streamlined the immunization process, reduced the number of injections needed for each child, and boosted overall vaccination coverage. Many countries have adopted the pentavalent vaccine to simplify delivery and save more lives, but few have done it as smoothly or as successfully as Uzbekistan. To sustain and expand progress, Gavi provided an additional $32 million in funding over the next decade. This long-term investment helped Uzbekistan expand cold chain systems for vaccine storage, train healthcare workers, monitor vaccination coverage and safety, conduct nationwide education campaigns for parents. Uzbekistan essentially built a robust immunization infrastructure from the ground up. Within just a few years, it became one of the most reliable programs in the region. Uzbekistan's transformation didn't happen overnight. It took political will, international support, and thousands of local healthcare workers going the extra mile in rural clinics, city hospitals, and mobile outreach units. But the result is clear. A country once struggling to protect its children from a deadly virus is now a regional role model for hepatitis B prevention. Part 5. An astonishing vaccination rate. Starting in 2002, Uzbekistan achieved something few thought possible, especially for a country with limited resources. They maintained a nationwide hepatitis B vaccination rate of over 95%. More than 95% of children across Uzbekistan received all recommended doses of the hepatitis B vaccine year after year. This level of coverage is exceptional by any standard. In fact, it's higher than in many high-income countries, where gaps in access, vaccine hesitancy, or logistical issues can bring national rates down to the 80s or even 70s. Why is 95% so important? According to WHO, when 95% or more of a population is vaccinated, it creates herd immunity. This means even people who can't be vaccinated, such as newborns, who are too young, or individuals with certain medical conditions, are still protected because the virus has nowhere to spread. By crossing that 95% threshold, Uzbekistan didn't just protect individuals, it protected entire communities. Let's pause to remember the context. This was once a low-resource country, struggling with public health infrastructure. The healthcare system had been fragmented, especially in rural regions. And yet, the government and health officials made a nationwide commitment to reach every child with the hepatitis B vaccine, regardless of where they lived or how wealthy their family was. The result is remarkable. An entire generation of children growing up protected from one of the deadliest liver viruses on Earth. A new milestone was reached in 2022. After 2 decades of steady progress and capacity building, Uzbekistan fully transitioned out of Gavi's financial support. The country now self-finances its entire national immunization program. Vaccine purchasing, logistics, staff training all are funded by the Uzbek government. And yet, vaccination coverage remains a rare achievement for a country that began this journey with international aid. Why does this matter so much? Because sustainability is everything in public health. Temporary programs come and go, but Uzbekistan proved that with long-term planning and political will, a country can take charge of its own healthcare destiny. They turned a donor-funded project into a national legacy, one that continues to save lives year after year, child after child. Part 6. Research that confirms the success. Implementing a national vaccination program is a major step, but proving its long-term impact through scientific research is what truly confirms success. In 2022, a team of public health experts, including researchers from the U.S., Centers for Disease Control and Prevention, CDC, and local Uzbek scientists set out to evaluate the results of Uzbekistan's Hepatitis B program. Here's what they did. The researchers randomly selected 3,753 children from grades 1 to 3, representing a broad geographic and demographic cross-section of the country. They collected blood samples from each child to test for the hepatitis B surface antigen, HBsAg, which is a clear marker of chronic hepatitis B infection. If present in the blood, it indicates the child is carrying the virus long-term. Simultaneously, the researchers reviewed each child's vaccination records to confirm how many doses of the hepatitis B vaccine they had received and at what ages. The findings were extraordinary. Only 0.2% of the children tested positive for HBsAg, than half the 0.5% target threshold set by the World Health Organization for hepatitis B control in the European region. According to the CDC and local investigators, this was clear evidence of success. As the report stated, this demonstrates the profound impact of more than 20 years of successful routine hepatitis B vaccination in Uzbekistan. In short, this wasn't anecdotal, it was measurable, verified success. The science proved that Uzbekistan's program had not only worked, but had exceeded global targets. Why does this matter? Because in public health, data is everything. Vaccines only matter if they protect people in the real world across all regions and demographics. This study validated that high vaccination coverage directly led to real disease control and confirmed Uzbekistan's place among a select group of countries in Europe that have achieved this level of impact. Looking ahead, the gains are expected to multiply. As more vaccinated children grow into adulthood, the overall prevalence of hepatitis B in the population is projected to drop further. Researchers anticipate that the burden of hepatitis B will shift almost entirely to older adults who were born before the vaccine was introduced. Over time, as these individuals age out of the population and younger, vaccinated generations take their place, hepatitis B could become extremely rare, even eliminated entirely. A generation protected at birth becomes the foundation of a transformed nation. Part 7. From Vaccination to Complete Elimination. Vaccination is the most powerful tool in the fight against hepatitis B, but it is only the beginning. Vaccines prevent new infections, but they do not treat or eliminate the virus in those who were infected before widespread immunization began. To fully eliminate hepatitis B as a public health threat, a more comprehensive strategy is required. What else is needed beyond vaccines? A successful elimination strategy must combine immunization with a multi-layered approach. Widespread testing. Many people with chronic hepatitis B are unaware of their infection. Without knowing, they cannot seek care or prevent transmission. Large-scale screening helps detect silent infections before serious complications develop. Access to antiviral treatment. While current medications do not cure hepatitis B, they effectively suppress the virus, halt liver damage, and reduce the risk of liver cancer. Treatment must be accessible, affordable, and ongoing. Infection control in healthcare settings. Hepatitis B can spread through exposure to blood and body fluids. Hospitals, dental clinics, and surgical centers must adhere to strict sterilization, needle safety, and protective protocols. Electronic monitoring of chronic cases. Once a patient is diagnosed, they need consistent follow-up. A national electronic registry helps track treatment progress, manage appointments, and monitor trends in disease outcomes. Uzbekistan is already making significant strides in these areas. Testing up to 1 million people annually, a large-scale screening program is underway, focusing especially on high-risk populations, such as pregnant women, healthcare workers, and blood donors. Creating a national electronic registry for chronic liver disease. This system tracks individuals diagnosed with hepatitis B, ensuring better care coordination, treatment continuity, and long-term monitoring. Vaccinating all healthcare workers at risk of exposure. By protecting frontline workers, Uzbekistan reduces the risk of healthcare-associated transmission and sets a standard for workplace safety. Developing a new national strategy for hepatitis elimination. A comprehensive plan is being drafted, based on WHO guidance, to help Uzbekistan transition from disease control to full elimination. The vision is clear. Stop the virus at birth. Screen the population for hidden cases. Treat those already infected. Protect healthcare environments. Build a national system for monitoring and response. Together, these steps bring Uzbekistan closer to a remarkable milestone: the elimination of hepatitis B as a public health threat. This is not just a medical victory, it's a model for the world. Part 8. A powerful lesson for other countries. The story of Uzbekistan is not just about medicine, it's a story about vision, commitment, and the power of public health when it's done right. More than just a success in controlling hepatitis B, Uzbekistan offers a blueprint for how other countries, regardless of size or income, can make lasting changes in the health of their people. 1. The power of long-term strategy. Uzbekistan didn't rely on quick fixes or temporary campaigns. It adopted a long-term national strategy and stuck with it for over 2 decades. Key lesson: real health transformations require consistency, patience, and a clear roadmap even if results take years to fully appear. 2. Smart, efficient use of resources. Despite being a low-resource country, Uzbekistan maximized the impact of every dollar received. The country began with external aid, but used it to build lasting systems, training healthcare workers, improving vaccine storage, and integrating birth dose vaccination into standard medical care. Key lesson: it's not just how much money you have, it's how wisely you use it that determines success. 3. National commitment at every level. From high-level policymakers to nurses in rural clinics, Uzbekistan's victory came from top-to-bottom engagement. Everyone understood the goal: protect the next generation from hepatitis B. They worked together to make it happen. Key lesson: health outcomes improve dramatically when there is unified commitment from government, health workers, and families alike. 4. Protecting children early transforms the future. By focusing on newborn vaccination, Uzbekistan ensured that children were protected from their very first day of life. As a result, an entire generation is growing up free from chronic hepatitis B, with a lower risk of liver cancer and a better quality of life. Key lesson: when you invest in children's health from birth, you don't just save lives, you reshape the future of a nation. Final thought: Uzbekistan's journey proves that elimination is possible. With smart policy, long-term vision, and commitment from every level of society, even the most persistent public health challenges can be overcome. For countries still battling hepatitis B, Uzbekistan stands as living proof that victory is not just a dream, it's a decision. Let this story inspire more nations to vaccinate, screen, treat, and commit, because the health of the next generation depends on the steps we take today. Conclusion: one small shot, one big future. Throughout this journey, we've explored how dangerous hepatitis B truly is, how infants and young children are especially vulnerable to chronic infection, how powerful and effective the hepatitis B vaccine can be, and how Uzbekistan turned a nationwide vaccination program into a lasting public health triumph. Take action. Make sure the children in your family are fully vaccinated. Support universal vaccination programs in your community and country. And never underestimate the power of prevention, because in the fight against silent killers like hepatitis B, the quietest solutions are often the most powerful ones. Thank you for watching. If you found this content helpful, please share it to spread awareness and protect more lives.